This is Kevin with nursingkamp.com. I'm doing NCLEX questions today on renal. Let's get into it. All the questions on this PowerPoint is from this Davis question and answer review for NCLEX RM. All right, so first question. The nurse is caring for a client with serum sodium of 152. Which signs and symptoms should the nurse expect the client to exhibit? Okay, so first things first, what's a normal sodium? 135 to 145. And this is also in the BMP. And the reason that's important is because these are labs that you would need to know for the NCLEX. So you have sodiums up here and then potassium's down here. Okay, sodium and potassium work together, peeing, puking, or pooping, and sodium is here. So sodium high is dry, and sodium low is uh-oh. And the reason it's uh-oh is because of, you need to figure out when a patient has a low sodium, are they hypovolemic or are they euvolemic? It means actual fluid. So that's a big concern. So when you have a patient that's low sodium, that's acute. And that's always acute because they can have seizures, go into a coma, and all that. But high is generally just dry. So let's look at that. So which symptoms should the nurse expect the client to exhibit? Dry-like symptoms, dehydration. All right, so first thing is sticky mucous membranes and thirst. Okay, that sounds good. That's true. Anorexia, which is basically loss of appetite. So the principle is this, is that nausea, muscle cramps. Okay, so muscle cramps can be dehydration. But this is subjective, and this is kind of vague. So we're going to remove that one. So we're going to say that's false. Tingling extremities and numbness is also vague. So, and most patients will always have this paresthesia, this tingling extremities. So you could have a hypocalcemia patient, a hypokalemia patient, a hyponatremia. They can all have this. This is always vague in the NCLEX. So we're going to remove that. Paresthesia is also vague. Dysrhythmias, generally with potassium and fatigue. That is dehydration, but there's a lot of factors that go into fatigue, so that's also false. That makes one the correct answer, just basically a content question. All right, next question. Clients diagnosed with acute renal failure. Acute renal failure or acute kidney injury. So acute kidney injury is vague, right? Because we don't know whether it is a pre, an intra, or a post. So it's not saying what it is. So the basic principle is it's a general acute renal failure question. So you have to understand the physiology. So you have your kidneys, then it goes down with the ureters, the bladder, and then out. Okay, so it's a fluid problem. So when somebody has acute renal failure, they have an increase of fluid. That's the general idea, and which is problematic because increase of fluid, nothing's coming out. There's also increase of electrolytes that normally go out by the fluids, all right, which is your magnesium, your calcium, and your potassium. So if they normally go out by the fluids, that's going to be problematic for the patient. All right, so potassium especially. All right, so the nurse assesses peripheral edema, which is fluid. Increased bounding pulses, in case you missed that, it's fluid, and JVD. So jugular vein distension, which is also fluid. So JVD is interesting because it is just like a CVP. Okay, and a CVP is see the volume peripherally, and that is generally 0 to 8. So 0 is dry and 8 is wet. Okay, so this patient has peripheral edema. Like what kind, right? Peripheral edema, like is it +2? Is it +3? Is it pitting? So always take the worst case scenario. It puts that patient more acute, right? So if you said this patient was weeping and they had peripheral edema and they're all just filled with fluid, that would make this patient more acute. JVD, so you put them at an 8, which is, or JVD 3 to 5, put them at a 5, and or CVP of 8. So pretty full with water, which means they're going to have pulmonary edema and all that stuff. Which interventions should the nurse implement? Select all that apply. So great. These are easy questions because they're just true, false content questions. All right, what are we looking for? Which interventions implement to deal with what? This kind of fluid, this edema and all that stuff. So we need to decrease that. All right, so administer IV diuretics. All right, well, that's true. Okay. Provide the client a regular diet. Okay, so is this patient, so here's how you answer this, right? So the first question is regular diet. What's in it? Could be salt in it, right? That will increase fluid. But here's another way to look at this. Regular diet, is that acute or is that chronic? Everybody gets a regular diet, right? So is this patient acute or are they chronic? Well, they're acute. So therefore that makes that incorrect. That's false. Next question, next answer. Place the client on a strict I and O. That's important, right? Because we're dealing with fluid. And any interventions that we're going to do, like diuretics, we want to see what's coming out. So also true. Put the client on fluid restriction. Well, that's obvious, right? Because they have too much fluid on board. And weigh the client weekly in the same clothes. Okay, doesn't seem like a bad idea. Okay, but let's do this acute chronic thing again. All right, weekly, is that acute or is that chronic? Okay, daily would be acute, right? But this is weekly, so that's chronic. So which makes that this is not the proper answer because this is an acute situation. It should be daily. Okay, so that's a false. And that gives us our next question. All right, moving on, next question. All right, client has a serum potassium of 2.9. Which intervention should the nurse implement first? First, now. All right, so potassium. So let's do some basic knowledge. All right, so we said that a sodium is 135 to 145, right? So sodium is up here, and then potassium is down here. So you take the 3.5, and then you crisscross 5.1. So potassium is 3.5 to 5.1. All right, so let's talk about what's acute and what's chronic, right? Acute is high, but also acute is low too, right? And because potassium is one of the electrolytes that you do need to know. There's issues with both of these, right? Whether high or low, it's going to be cardiac, it's going to be rhythm changes. However, here's the big difference. High potassium is really toxic because the potassium keeps on going, especially with an acute renal failure patient. You have all this fluid on board and this potassium rises. Ultimately can go to VTAC, which can kill the patient. And that's rule number 1, don't kill patients. So low is generally slow. Okay, so slow. And what we do is that we replace that potassium generally. But generally what happens with a low potassium is we want to see what's going on with the patient because everybody can be bouncing around a little bit low and then we're going to get an order to replace that potassium. But it's not the most likely. Peeing, puking, or pooping generally will cause that. All right, so let's get into the answers here. So client's potassium is 2.9. Okay, so we said low is slow. Interventions implement first to replace and to deal with this potassium. Okay, so first, best, most, first priority action means assessment and implementation. All right, so administer IV potassium. Okay, that's great. There's nothing wrong with that. That's an implementation. Encourage foods high in potassium. We already know that's incorrect because, maybe it's correct that high in potassium. All right, so that's also implementation. Okay, so place the client on a cardiac monitor. Implementation assessment. Okay, so implementation assessment. Monitor the client's I and O. Okay, assessment. Okay, first question is we have assessments and implementations. Okay, is the patient in distress? That's the first question, right? Is the patient in distress? What's the topic? Low potassium. Are they in distress? All right, well, let's go back to the question. All right, so client, serum potassium 2.9. Okay, well, that's data. All right, that's the blood work. When was that drawn? I don't know. All right, which intervention should there's no patient. Like, what is it? Is it a male? Is it a female? Is it a horse? What's the deal, right? So we don't really have any data, nothing, right? Other than just this. So this is a principle that you never treat a monitor, right? And you never treat just a lab that you see, okay? Unless you have patient data, right? Well, what's the patient look like? I don't know, right? So I need assessment. All right, so the first question is, this is a distractor. So this is an assessment, this is an assessment. So place the client a cardiac monitor. Well, yep, cardiac's definitely an issue for low and high. So we're going to select that one. Monitor the client's I and O. Okay, what does this mean? So this in class, monitor. How long? Is this monitoring, is that acute or chronic? Is that a strict I and O? So this is a chronic response. It's not going to give me any real data, so I'm going to get rid of that one. But let's go back. This is the correct answer here. Place the client on a monitor because that's going to give me patient data. That's what I want. All right, so look at this distractor. Administer IV potassium. No kidding, right? You got a potassium 2.9. Give potassium. Oh, thank you for that. That's an easy question, right? No, that's a sight reader, right? When you look at it, you see it, and then it's what it is. What could you do first? If you could do anything in the room right now about the patient, what would you do? Well, put them on a monitor, see what they are. You know, I might also assess bowel sounds, you know, because low is slow. So they're risk for paralytic ileus, you know. Low is slow, you know. I mean, muscle weakness. The deep tendon reflexes are going to be low, right? So all these things about the patient needs to be known. But by just giving potassium, I'm not treating and assessing what's going on with the patient. That makes 3 the credited answer. All right, next one. Client who is 1 day post-op bilateral thyroidectomy complains of numbness and tingling, thanks for that, around the mouth, tips of the fingers. Which intervention should the nurse implement? Okay. All right, so is this acute or is this, so what's the topic? I got a patient here, thyroidectomy, so the risk is thyroid storm, all that stuff, endocrine stuff. Complains, okay, so in case I didn't know that that was a problem, they're complaining of numbness and tingling around the mouth. Okay, that's an issue. Tips of the fingers, that's also an issue. Because what is this? This is very vague, right? So vague. They're complaining of it. I don't know what's really going on. Which should I implement? All right. So it's, which should I implement? Implement first. So notify the client's healthcare provider immediately. All right, well, thanks for that. That's an implementation. Check the blood pressure. See if the hand makes a claw shape. Okay, that's also important. Assess. Check the serum calcium and mag levels. That's also assess. And prepare to administer calcium gluconate. That's implementation. All right. So the first question is the patient in distress? Okay. Well, the 1 day post, so that's 1 day post, so it's 24 hours. 24 hours is complication. Thyroidectomy, the risk is with thyroidectomies is decrease calcium. So this is a hypocalcemia question. So the overall arch is thyroidectomies cause decreased calcium. So it's asking about that calcium. All right, so let's look at that. So we said this was an implementation, this was assessment, this is an assessment, and then this is an implementation. So the same thing is generally medications in the answers are generally distractors, okay? Because NCLEX tends to really say, hey, you know, here's a problem. They have hypocalcemia. Hey, they have hypokalemia. Give potassium. You know, I mean, why would you do that, right? They're not gonna, you know, it seems too easy, right? So it's more about assessment. What is the nurse going to do? Okay, so is the patient in distress? Well, complains of numbness and tinglings of the mouth, tips, and fingers. All right. Well, what is that? It's vague, right? I mean, it could be something. I don't know. I'm going to look at it, right? So what do I need? I need assessment. I need to assess my patient. All right, so I get rid of my implementations and look at them, right? Notify the healthcare provider immediately. Hey, doc, I get this patient here. Yeah, he's got really tingling in his mouth and tips and fingers, you know. Hell, I have that, you know what I'm saying? If I sit wrong or whatever. So it's not really acute, right? More data, I need more information. This other implementation, which we just said, giving calcium for a hypocalcemia patient. So what's a normal potassium, right? So calcium, I mean. So we said that this is mag, this is calcium, and then this is phosphorus. So 1, 2, 3, 4, 0.5, 0.5, 0.5, 0.5, 8 to 10, or 8.5. Okay, so low, less than 8.5 is hypocalcemia. And what's the risk of that, right? Fast-like symptoms, seizures, trousseaus, chevectics. That's when you touch the side of the thing and do that. All right, so check blood pressure as an assessment. See if the hand makes a claw. Okay, that's a hypocalcemia issue. Give out the claw. And then check serum calcium. There's nothing wrong with that. But if I could do anything in the room, what would I do first? Get my hands on the patient, assess the patient, and then go from there. All right, next question. All right, the nurse in a UAP is caring for clients on the urology floor. Which nursing task should the nurse delegate? Okay, so to UAP. Stable patients, stable outcomes, okay. All right, stable patients, stable outcomes. All right, so let's go through it. Increase the continuous bladder irrigation fluid. Okay, is that a stable outcome? Well, if I'm increasing fluids, what do you mean? Is it direct? Is it honest? Is it clear? No, that's vague, right? So I don't delegate vague things. So I'm going to get rid of that. And there's a potential for injury there. So stable patients, stable outcomes. Direct things. Elevate the client's scrotum. That's exactly what it is. On a towel roll for support. Okay. Makes sense, right? I mean, edema. I'm not going to draw anything. Okay. So we're going to keep that. Change surgical. No. For client 1 day post-op. No. That's the nurse. Teach the client to care for continuous. Okay. Here's the thing about UAPs. UAPs can reinforce teaching. Okay, so if you teach it, they can say, hey, you should do this. You should get up and move. But they have to be, the teaching has to be done by the nurse and not by the UAP. So should the nurse delegate? So you wouldn't delegate any teaching. So they say that never ever delegate anything that you can eat. Evaluate, assess, or teach. So never ever delegate these things. All right, so that leaves elevate the scrotum. That makes 2 the correct answer. All right, next question. Laboratory data reveals a calcium phosphate renal calculus. Okay, so acute kidney injury, pre, in, post, so post-renal problem. Diagnosed renal calculi. Which statement indicates client understands discharge teaching? Okay. All right. So this is just a teaching. This is a content base. So it's not even an acute kidney injury. All right. So it's about calcium phosphates, calcium phosphate diets and stuff like that. All right. I'm going to eat liver, organs, meat only once a week. Once a week. Okay. Good to know. No, it has nothing to do with calcium. I should drink at least 2 glasses of cranberry juice. That's calcium. I must limit how much milk and dairy products I must consume. Understands looking for something right. Okay. Yep. Keep that one. I'll urinate every 2 hours so I don't develop a stone. All right. Is this measurable? Every 2 hours. So 2 o'clock in the morning, 4 o'clock in the morning, 6 o'clock in the morning. Get it? It's not. It's not. It's too specific and unmeasurable. So you have to get rid of that one. All right. So that gives you your credited answer. This is just a basic content question on calcium diets and calcium. All right. Next question. All right. Nurse and a licensed practical nurse are caring for a group of clients. Which nursing task should be assigned to the LPN? Okay, let's talk quickly about LPNs, right? So LPNs don't assess, but they can differentiate between right and wrong. So because they have the training, they have the understanding and everything like that. But they generally take care of stable patients, stable outcomes. All right, so here we go. So stable patients, stable outcomes. Which nursing task should be assigned to the LPN? Okay. All right, assess the client who had a cock pouch procedure. Okay, we can't assess, so we get rid of that one. Monitor the client who's 2 days post-op who had a white count of 7,000. Okay, all right, that doesn't sound bad. It sounds stable, right? It's past 2 days, right? So it's past 24 hours. So they can differentiate between, you know, normal versus abnormal. So we're going to keep this one. Okay, administer anti-neoplastic medications. All right, so prescribed, administered. They can give medications, but this is interesting, right? Anti-neoplastic medications. What kind? Right? What are they? Right? Cancer meds, right? So that's interesting, right? Because what kind of meds are they, right? Are they IV? Are they through a port, right? Can they put them through a port? So take it to the extreme. So anti-neoplastic, can you name me 5? Now you as a nurse, if you can't even name 5 of them, you can't even name 1. You know, it's got to be acute. So how the hell would a LPN know what anti-neoplastic meds are? All right, so get rid of that. Next one, discharge the client with a new ileo. Okay, well, it's new, which would require teaching. They can reinforce teaching like a UAP, but they don't do any of the teaching. So we're going to remove that one too. That leaves this one here as the most stable patient. All right, next one. Okay. Clients diagnosed with end-stage renal disease are receiving peritoneal dialysis. Peritoneal dialysis. All right. Which assessment data is warranted immediate intervention? So looking for something wrong. Right. What's wrong is infection. And let's get into it. So, all right. So peritoneal dialysis, inability to palpate your thrill over the fistula. Well, this is not a hemodialysis patient. This is peritoneal. He wouldn't have a fistula, so it can't be that. So a sight reader might say, okay, well, palpate the thrill over fistula. Okay, that's what it is, right? That's sight reading, right? But it's not looking at the question, because the question is about peritoneal dialysis. And the concept of peritoneal dialysis is that you always start with, so peritoneal dialysis will always start. And then if they have an infection, like peritonitis or something like that, then they go to HD, hemodialysis. But you never go backwards. You never start off with HD and then go to peritoneal dialysis. So this is straight up kind of a tricky question a little bit. But the principle is that, it's not possible that they would have a fistula and doing peritoneal dialysis now. It just doesn't work that way. All right, so that's incorrect. All right, so which immediate intervention? All right, so abdomen soft, non-tender, has bowel sounds. That's a good thing, right? So get rid of that. The dialysis being removed from the abdomen is cloudy. Okay, thank you for that. And the dialysis instilled is 1,500 and removed was 2,100. Okay, well, they might have had some retention from before. And the big thing with peritoneal dialysis and retention is that's why they get on laxatives and Colace and stuff like that, to allow for the fluids to exchange back and forth, high fiber diets. That allows that the fluid exchange back and forth. So generally the rule of thumb is that, it's generally 500 cc's, right? But it has to be over 4 dwells, I believe. And that's what That's what you have to see. So just because it happened once, you never call the doctor for it. You turn the patient side to side and you figure out what's going on. So this is actually a good thing, right? Because that there's more fluid coming out. So he probably was retaining some fluids before, and then they go back into it. So that makes 3 the credited answer, because peritonitis is the answer for that. All right, next one. All right, next one. Client diagnosed with acute renal failure. What kind? Is it pre, post, intra? Okay. Big issue is kidneys. Kidneys, nothing's coming out. That means no calcium, magnesium, phosphorus, potassium. Right, and that's that one here. Right, but potassium is 6.5, so we have this, and potassium is here. So the last question we had was low, right? High is acute, right? Because you call them the King C, right? King C. KX insulin, glucose, calcium. What kind? Calcium gluconate. All right, so which collaborative intervention? Collaborative, okay. Collaborative, that's a key word there, right? So it's not individual, right? So it's kind of what's going to solve this problem. Well, it's an emergency. This patient is acute, right? They're in acute renal failure. I don't know what kind, so right away it can be any one of them. It could be intrarenal. So administer phosphate binders. Right? Hey doc, I need his phosphate binders over here. Well, is it PO? Is it IV? What? Fake, right? So, and phosphate, it's not acute, right? Calcium is acute. Mag is acute. Phosphorus is not acute. Type and cross match for whole blood. Okay, is that solving the problem now or later? Okay, now. All right, administer cation exchange resin enema. Is it acute or is it chronic? I don't know. Hey, doc, can I get an enema up here? I know I'm waking up in the middle of the night, but this guy's potassium's got 6.5. It's really, no. See, it just doesn't make any sense. It's not acute. The process of it's acute, but the principle is that it's not really, it's vague, and it doesn't solve the problem now or later. More later, if anything. Prepare the client. That's very collaborative. This patient needs hemodialysis. Why? Because they could die. Because they first have peak T waves, right, with potassium. In actuality, this T, level of potassium can actually be seen by this, the length of this amplitude of this T wave, as far as like it goes from, whatever it is, 3.5, and then it goes 4, then it goes 5, based on how high that peak T wave goes. It's kind of cool. But the big risk is that as that peak T wave goes like this, it turns into VTAC. And VTAC is shockable and is acute. So this patient needs hemodialysis now. All right, next question. Clinic nurse is discussing. Okay, so clinic nurse, look where you are. This is chronic. So this is an acute. So either patients come in, right? So they're sitting in the clinic. All right, discussing the clients. Discussing. So also chronic, right? Frequent asthma attacks. Well, how many, right? That's the first question, right? I mean, I don't know, 40 a day, right? Doesn't say. So which intervention should the nurse implement? Okay, so discuss implementation, ask the client when and where assessment, tell the client to do something, teach the client to avoid implementation. So 3 implementations and 1 assessment. Okay, well, is the patient in distress? Well, I don't even know, right? I don't even know what frequent means, right? So I don't know. So I would say they're not in distress because, for one, they're in a clinic. You're discussing something to them. And this frequency, what is that? What do you mean frequent? So this assessment, if I ran this assessment, what would I get? Ask the client when and where the attacks occur. Okay. Well, every time I come home at night, I go into my house and it's a chicken house. I have a bunch of chickens in there, right? So, that's a problem, right? That would tell you, well, move from the chicken house, right? There's an issue there. So that data of assessment is very important. So I would pick that. The other ones just don't make sense. Discuss the client moving to a different climate. What does that mean, right? Maine, St. Martin, Texas, whatever, right? Tell the client to buy cotton linens for the home. Now you're giving them a job to go buy stuff. No, it doesn't make any sense. Teach the client to attempt to avoid all stress, all, everything. It's too absolute. Gotta get rid of that one. Makes that one the correct answer. All right, so next question. UAPs caring for clients on a GU unit. Nursing tasks would be most appropriate to delegate to UAP. Stable patients, stable outcomes. Okay, stable patients. Right? Right task. Right? Never ever delegate anything that you can eat. Evaluate, assess, or teach. Never ever. That's the rules of delegation. All right, so insert a 20 gauge catheter in a client. No, that doesn't make any sense. That's inappropriate. Empty the client's nephrostomy in the urine output. Okay. Seems okay, right? Doesn't seem problematic, right? I'll keep it. Next one, assist the client to ambulate with a gait belt. Client, okay. If I'm delegating it, I'm doing the right thing. So I'm going to keep that. Discuss safe sex practices, client being discharged. That's teaching. No. All right, so I get 2 here. So I have empty client's nephrostomy, urine output, and ambulate the client with a gait belt. Okay. What's the most stable patient? This one. Right? Is it an actual problem that they'd fall, or that's why they have the gait belt, right? So don't give it a potential problem. Empty the client's nephrostomy, urine output. Okay, does everybody here know nephrostomy? Have you emptied a nephrostomy? Do you know the risk in the assessment of a nephrostomy? Is it a new nephrostomy, right? So is there complications with the nephrostomy, right? The nurse should be doing that, not. So they can empty a Foley because Foley is chronic. As far as emptying it and stuff. But the nurse is the one that monitors this. This will require other assessment to it. So the appropriate delegation is that gait belt. Okay, female. Okay, good for that. That's specific because if it's telling you the sex, it's definitely specific. UAP on the GU unit reports low back pain. Okay, so there's a problem. Low back pain. After transferring a client. So problem with doing movement of a client from the bed to the wheelchair. Which priority action should the charge nurse implement first? So first thing first is, what are you going to do now that is going to address this problem of transferring a client from bed to a wheelchair? Reassign. So here's the problem. What are you going to do? Go over there. Do that assignment. Don't do that assignment anymore. That's unrealistic and also doesn't solve the problem. It's just basically passing the buck. Get rid of it. Send the UAP to the ED, okay, which might happen, right? But the principle is that, here's a problem, right? Like, what are you doing to address the issue, right? So is there something I can do first, right? So completing, I'll keep it. Completing, okay, also would happen, right? But does it solve the problem, right? So I'm going to keep that. Notify the employee health, yeah. I mean, that's the chain of command, right? So, I mean, you level it up, right? So, because it goes from here, right? Because then this person could be, hey, they're the employee health nurse, right? So they're going to figure out, listen, you don't slide a patient that way. You use the Hoyers and stuff like that. So this is the credited answer. All right. Client's calcium level is less than 7. Which assessment data would the nurse expect the client to exhibit? All right, first question is that it's calcium. Okay, so we have calcium like this, and we say 1, 2, 3, 4, 0.5, 0.5, 0.5, 0.5. 3 plus 5 is 8, 0.5 to 10. Okay, so this is calcium, mag, and phosphorus. All right, basically is that if this goes down with it. And if this one goes up with it. Okay? And then these two have an inverse. So as this one goes down, phosphorus goes up. And then if this one goes down, phosphorus goes up. Okay? And that's kind of how it works. All right. Client's calcium level is 7. Right? Well, that's low. So low. Okay, low is fast-like symptoms. Right? So fast-like symptoms like seizures, twitching, right? Chevectics, right? So when you touch the side of the face, look at that. Or the claw, right? To get the claw when you put a blood pressure cuff on them. All right, so which assessment data would the nurse expect? So it's basically a hypocalcemia. Okay, flushing of the face and hypoactive. No, they would be hyper because they're fast-like symptoms. High calcium would be hypo. Constipation, that's slow-like symptoms. Polyuria is fast, right? And polydyspia is fast, right? But this is a mix, so no. Dysrhythmias, spelled wrong, with peak T waves, okay? That's also incorrect. Positive Trousseau's sign. This is potassium, by the way. High. Positive Trousseau sign and diarrhea. Yep, fast-like symptoms. All right, that concludes the renal question run-through. See you next time.